So, let's be honest. Going to the dentist is one of those things that can make just about anyone a little nervous. I mean, even just sitting in that waiting room, you feel your heart thumping, right?
Totally get what you mean. The last time I was in a dentist's waiting room, I caught myself clenching my jaw without even realizing it. And then when the nurse called my name, I swear my stomach did a little flip.
Oh, absolutely. And once you're in that chair, the nurse says, sit here, and suddenly you're super aware of your breathing. Then comes the classic, open your mouth. It's like, okay, here we go.
What gets me is that moment when the dentist comes in and asks how you're doing, and all you can think about is that one tooth that's been aching. It's funny, but the pain almost feels sharper as soon as someone asks about it.
Exactly. There's something about naming the pain that makes it real. And then, of course, the questions start rolling in. Where is the pain? Which tooth? Suddenly, you're pointing to your jaw, trying to remember if it's the molar or what's that other one?
Yeah, it's usually the molar, right? The big back tooth. And sometimes the dentist asks, how bad is it? 1 to 10? That always makes me pause like, is it a 5 or a 6?
Honestly, I always feel like I'm underselling or overselling it, and describing the pain sharp, dull, throbbing, it's not easy, especially when you're a bit anxious. But knowing those words really helps you communicate clearly. That actually reminds me, let's talk about what happens if the dentist finds a cavity. People hear cavity and think, uh-oh, here comes the drill. But what is a cavity, really?
So, a cavity is basically a little hole in your tooth, the spot where bacteria have worn away the enamel. And when the dentist says you need a filling, they're going to clean out that decay and fill it up so the tooth gets strong again.
And before that, there's the whole numbing thing. Sometimes the dentist asks if you want to numb the area before they start. I know some people get nervous about the shot, even though it's quick. There's always that little pinch.
For sure, the idea of a needle in your mouth isn't exactly pleasant. But the numbing is a lifesaver. It means you won't feel the drilling or cleaning. Your lip or tongue might feel a bit funny for a while, though.
Oh, and then the dentist uses all those tools, a mirror, a light, that little drill that buzzes. Sometimes you feel pressure, but as long as you're numb, there's no sharp pain. That's such a relief.
I love that feeling when the noise stops and they say, all done, and getting instructions after like chew on the other side or use a cold pack if there's swelling. It's easy to forget those details if you're still a bit nervous, so I always try to write them down or ask for that care sheet.
Funny you say that after the dentist visit, that's when you really start to notice the little aches and sensitivities. Sometimes your jaw or tooth just feels tired or sore for a day or two.
That's pretty normal. The dentist always tells me the tooth and gum might need a few days to heal. If it's just a dull ache or the area's a little sensitive, soft foods and a warm salt water rinse usually help a lot.
Right, and if you get swelling or feel pain after the numbness goes away, an ice pack for 10 minutes can really make a difference. But if the pain gets worse or you get a fever, it's definitely time to call the dentist or visit the clinic.
Absolutely, and it's good to remember those pain words sharp, dull, throbbing, sensitive, so you can describe what's happening if you need extra help. Plus, don't forget the basics. Brush gently, use a soft brush, and give your mouth time to rest after a filling.
And for long-term care, it's all about the simple habits: brush twice a day, floss once, and regular dentist visits. Small steps, but they really help keep the big problems away. Before we wrap up, I always find it helpful to quickly review those key words: tooth, pain, cavity, filling, numb, drill, swelling, medicine, call, rest. Feels good to have those at your fingertips.
Definitely. And practicing short sentences like, I have a toothache or it hurts when I bite, that makes it way easier to speak up when you're at the dentist. Practice really does make perfect, even for these little things.
So if you're listening, remember to give yourself a pat on the back for learning today. Next time you're at the dentist, you'll know what to expect and what to say. That alone can take away a lot of the stress.
Honestly, just being able to name what you feel and ask questions makes the whole experience less scary. Here's to happy, healthy smiles and much calmer dentist visits ahead.